Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and Bill Kearney in the studio for a pre-recorded program. It's the day before the actual air date, so it's Tuesday now, but you'll be hearing this on Wednesday.
Yes.
And you'll be out of town.
I do. I've got to fly out at 6 in the morning and get to Madison, Wisconsin to a board meeting, and then I'll be back. But not in time enough to do our radio show, so we're doing a pre-recorded one, which is going to be kind of a potpourri of different things. You know, we've talked a lot about accountability on what people should do. And by the way, our number's 263-5252, but you can't call it because I won't be here tomorrow.
I was just going to say.
I never say that when they can call, and then I find one that we can't call for them. Anyway, we talk about accountability as far as being accountable for your health history and knowing what's going on. And I had taken a friend of mine, which I can't name my wife anymore as somebody that. So I'm talking about a friend of mine. I took down to CPMC last Thursday. We spent all day down there doing some tests and finding out what's wrong. And luckily, I was there as a historian of some of the previous medications that this individual had been on, and what the results of those had been and whether or not they'd been effective for a specific disease or not. And it's extremely helpful when you have someone that's, number one, not afraid to talk to a physician, and number two, has documented a history of what's going on in treating the particular disease. So I was... sometimes I'm not treated because I'm a pharmacist. I'm not treated as being that knowledgeable by some physicians, and others are very receptive to my input. So in this particular case, both physicians that we saw were interested in my observations of this individual when we were going through this process of treating this disease state. So it really helps to be prepared, and some of the things we're going to talk about today are things that you can be more prepared for when you go see a physician, and especially if you're seeing a physician for the first time and seeing a specialist that has a lot of interest in the diagnosis that you're bringing forward, and probably much more knowledgeable than me or most other physicians in their field. So as we as pharmacists are pretty much up and educated on medications that you take, treating the diseases is certainly something else. But this is the kind of season where people are getting smoke inhalations from the fires, getting poison oak and poison ivy from being out in the area trying to get away from some of the things, and cutting down your weeds so you're not in a position to have a fire around your house. And many times people will get poison oak around here and want to know what to do about treating it. Lots of people aren't as sensitive to poison oak and poison ivy as other people, and I'm one of the people that respond to it rather briskly. I get it right away, and it gets into the bloodstream, and then you have a real issue. I have been out cutting weeds, and I have a stairway that goes down to the beach, which is quite steep, and trying to keep the weeds down from that area, and there's poison oak in that area. The first thing I do, I wear long pants instead of shorts, and boots that kind of cover that area between your pants legs and your feet, and I still worry about my hands and my arms even though you're wearing a long sleeve shirt. So the first thing you do is wash the area as soon as possible, and there's all kinds of products on the shelf for Xanafil and Tecnu for a barrier to keep you from getting poison oak, but they aren't any more effective than using soap and water. So don't rely on those barrier products like IVX and pre-contact for prevention. try to wash yourself with soap and water as soon as you can. And remember, your clothes have that uricidol, that poison, that's contact poison that's on your clothes and on the animals that might be with you, and it's important to not re-expose yourself to this. There's a lot of over-the-counter products. Dome Burrow is one of those, calamine lotion or oatmeal baths like Aveeno that helps soothe the itching or dry weeping rashes. Cool compresses help. It's just the discomfort of that itching, and you want to, it's kind of like athlete's foot. You want to scratch it so bad that you make yourself, have you ever had poison oak,
I get
Paul?
it bad, yeah.
Do you?
Yeah, I get it bad. Maybe not to the extent where it goes, I've ever had it go into my blood or anything like that, but yeah, I get it. And then, you know, if it's in a spot that's somewhat reasonable, you know, pain-wise, I usually treat it with bleach.
Yeah.
I'll put bleach on a rag and then put bleach on the poison oak, and it hurts, but it dries it up really quickly.
I tried to do that. I had it really bad about 15, 20 years ago, and I got it into my bloodstream. And I was going on a cruise, and they didn't know how to treat it on the cruise. And so I suggested the steroids, oral steroids, which were much stronger than the steroids that we have here. And also I would go into the salt water.
Yeah,
and
that should help too, probably.
And then every night they would put sheets around my arms and just peel the skin off. It was really something else. So
I just got goosebumps thinking about it. I know the pain.
Yeah. So you know, you try to use antihistamines like Benadryl, diphenhydramine, and antibiotics or anesthetics that like benzocaine for a spray. They don't seem to help very much and may increase skin irritation. The reason the antihistamines don't work is it isn't a histamine reaction. It's not an allergy. It's a poison that gets on the skin. They aren't likely to relieve the itching since the reaction doesn't come from poison ivy. That's not due to, it comes from the poison ivy, but not due to histamine release. So hydrocortisone or a cortisone type preparation sometimes can be tried for mild symptoms, but it's too weak for most of the severe cases. I can remember where everybody used to get TAC ointment or cream, triamcinolone, 0.1%, and by the pound jars that really had it bad. But it's really not strong enough. If it's more severe cases, you need a medium or high potency topical steroids such as betamethasone for moderate to severe symptoms. The best thing is to start it before those vesicles, those pussy sores, start to occur. And oral steroids for the most severe cases. And here the favorite thing is to prescribe a Pred pack, which is a Medrol dose pack. And if it's really widespread, that isn't enough to normally get rid of it. I've had to take 2 or 3 of those sometimes. When the rash covers more than 20% of the body and affects those sensitive areas, you start with up to 60 milligrams a day. And, you know, it's different for physicians. Some physicians will give you 20 milligram tablets and tell you to take 3 times a day for 5 days, and that's it. Some will start with a Medrol dose pack, and if you ever get one of those, it says on the back of it, take so many before breakfast, so many before lunch, and so many for dinner, and so many at bedtime. And it starts out with 8 or 10 tablets a day. And you can also take all of those at one time if you desire. You have to just make sure and take it with some food. And that will start the process going. And that isn't always enough to do it. And I've had people that will get in the hot tub after they get it because they think it makes them feel better. It actually increases the circulation so much that it gets actually worse. So the best thing is to start with an oral steroid, or with a topical steroid creams like betamethasone, and then go from there and try to follow through exactly how the doctor says. The difference is with the dose pack that we talk about, 8, 7, 6, 5, 4, 3, 2, 1. You can take all those tablets in one row at one time because they're a small milligram, and then you don't have to worry. The only reason they say before breakfast, before lunch, and before dinner, and at bedtime is because you have some food in your stomach, and sometimes they can give you some heartburn. They also can cause some atypical things with your central nervous system. It can make you extremely hungry. You can get anger. I think I had them all. You know, I was mad because I was on a cruise and I couldn't
Yep.
I couldn't enjoy it, and then I was in pain so much that. How long does yours usually last, Paul?
Oh, you know, if I bleach it, if I'm able to get on it and bleach it, maybe 3 days, you know, something like that. Otherwise, you know, 4 or 5 days, depending. And you know, if it gets to the point where it's, you know, the pussing and stuff like that, and I bleach it, then it's usually just a day it dries right up.
Really?
Yeah. So, but the, you know, you can't bleach in certain areas. If you know what I mean.
Yes, and I had all those areas affected.
Yeah, so there's only so much you can, you know, so much pain you can take.
Yeah.
And luckily the last couple times I've gotten it, it hasn't spread beyond like my arms. You know, I've got it on forearms and so on and so forth. So, but I remember one time I got it, it was all over my whole body. It was bad. It was like I rolled in it or something.
Right.
Yeah, you know, and I don't know how it spread like that. You know, it must have been through clothing or something, but you know.
Yeah, you can get all those clothes off and and just do a cool water wash, and it's still there.
Still there. Yeah, you never know. So.
Well, the other thing that we want to talk about that's completely opposite of that is marijuana, and the reason marijuana is on the topic today is because every newspaper you pick up, every television article is about somebody trying to get legalized in dispensing marijuana or growing marijuana. And I just talked to an individual this morning that it was going up looking at the possibilities of deer for deer season and walked right into 2 or 3 grows on people's property that had no business being there. But what I'm going to talk about is really the pharmacological issues that we've heard. There's nothing wrong with marijuana. It can't cause cancer. It can't kill you. It can't do this. Well, there was a study that people who smoke 3 times marijuana that smoke marijuana have a 3 times greater risk of dying from hypertension or high blood pressure than those who've never used the drug. And the risk grows every year that you use it. So these findings from a study of 1,200 people could have implications in the United States, among other countries. Several states have legalized marijuana, and others are moving toward it. It is decriminalized in a number of other countries. I had to take a survey this morning because I was a pharmacist from the National Community Pharmacy Association on how I felt about the legalization of marijuana, and whether, and then they broke that down into recreational marijuana and medical marijuana, and what was I in favor of and what was I not in favor of. I think for the medical reasons there are some diagnoses that it's very good in implicating for glaucoma and for some other things, even some pain issues. But support for liberal marijuana use is partly due to the claims that it's beneficial and possibly not harmful to your health. This gal from Georgia State University led the research at the School of Public Health at Georgia State and said it was important to establish whether any health benefits outweigh the potential social and economic risks. If it's implicated in cardiovascular disease and deaths, then it's on the health community and policymakers to make the public aware of that. So the results showed that marijuana users had a 3.42 times higher risk of death from hypertension than non-users, and a 1.04 greater risk for each year that they used it. So there were limitations in the way that marijuana was assessed, including the researchers could not be sure whether the people had used the drug continuously, since they first tried it, but the results chimed in with possible plausible risks, since marijuana is known to affect the cardiovascular system, or your cardiac part of your body. And marijuana stimulates the sympathetic nervous system. Now, there are a lot of people that think that it's just the opposite of this and stimulates your parasympathetic nervous system. What's the difference between sympathetic nervous system and parasympathetic nervous system? The difference is one is a stimulant that causes your body to react in a more rapid way. And the parasympathetic nervous system is just the opposite. It slows down the mechanism of the body, and so your secretion is less, your speech could be much less, your central nervous system goes into a slower mode than it would if you were having a stimulant. Experts that weren't directly involved in the study said it would need to be replicated, but it already had raised concerns with these people who didn't have a direct link to marijuana. And despite the widely held view that cannabis is benign, the research adds to previous work suggesting otherwise. That said, that it's something that we need to do further study on. I have seen people that smoke marijuana every day that were very hyper. I have seen people that would have marijuana on an occasional basis that didn't seem to be overly stimulated at all. In fact, at one point, those people would be taking methamphetamine and then take marijuana to bring themselves down. So there's a big controversy on whether or not there's a clinical evaluation that would cause meaning from clinical studies that would cause people to have a hypertension or elevated blood pressure from taking it, and the longer they smoked it, according to this research, the more likely they would be to die of hypertension or high blood pressure. So you will see a lot more. The problem is, as we've talked before about marijuana usage, is we can't, because it's a product that's not patented, it's hard to get researchers to do study on it because they need research money in order to do this. And there isn't one company that just produces marijuana that is willing to have clinical evaluation. Now, some of that is because they're afraid of what it would show. But right now, the impetus is to get more and more people growing marijuana so they can make more and more money, and not specifically for the betterment of the public, but for the betterment of people's pocketbooks. So when evaluating the survey, I was not optimistic about the recreational use of marijuana, which is allowed in the state of California. I was not optimistic about taking edibles and marketing it, and I was optimistic about it being dispensed in a pharmacy because one of the questions was what class of drug should it be in. And in this case, currently it's in a Schedule I drug, which means that it's completely prohibited from being prescribed except in states that override that. And the second thing is that it is mandated or tried to be mandated by the federal government to put it in, by the state governments to put it in a different class so it could be dispensed. I think it should be dispensed in a pharmacy. Do I care? Would I be doing this to try to get wealthy from dispensing marijuana? Absolutely not. I wouldn't care if I made a dime if I kept people from getting it that had no idea when they took the cannabis that the medication they take from a physician would be compromised, or there would be a counter-indication in why people were taking it if they were taking a prescribed medication that would interfere with that. I think that's one of the worst things that can happen. And right now, you can go to a dispensary and get marijuana for any kind of condition there is. And won't do you any good to have phone calls tomorrow about this because I won't be here. But I feel very strongly about that. California schools are trying to enforce the immunization process of kids going to school, of having their shots. And even with the new law that's boosted kindergarten vaccination rates to record highs, hundreds of schools across California still have so many children lacking full immunization that they posed an increased risk of disease outbreaks. And this was in the LA Times yesterday. Nearly 750 schools, 90% or fewer kindergartens had been fully vaccinated last year. Experts say the rate should be at least 95% to prevent the spread of highly contagious diseases such as measles. If you remember, back in 2015, there was a Senate bill, 277, that was approved after there was a measles outbreak at Disneyland. The law bars parents from citing religious or personal beliefs to keep their children from getting immunizations, but some who already had such exemptions were allowed to keep them. The rest of the unvaccinated children need a form that's signed by their doctor saying they had a medical reason not to get their shots. In the school year that began last fall, the law's first year, the number of kindergartens in California with medical exemptions tripled. Now, these are people that should be getting shots, but they got exemptions from physicians. Physicians say that at most 3% of the people could have a medical reason for not tolerating vaccines, such as a gelatin allergy or because they're undergoing chemotherapy. But the LA Times found that 58 schools, 10% or more kindergartens, had medical exemptions last fall. That rate topped 20% at 7 schools. And as far as researchers and people that are trying to get immunizations up to the standard that we need to protect all of our children, it's just totally wrong. Experts say that some parents who are hesitant about vaccines may be asking doctors to vouch that their children have medical reasons to avoid them or get them later when they're required by law. Public health advocates cheered the law's success when the fraction of California kindergartens who were fully vaccinated jumped to 96% last year. But a new school year begins this fall, and the high number of unvaccinated kids at hundreds of schools last year has raised questions about whether even one of the strictest laws in the nation can persuade parents who are skeptical or fearful of vaccines to immunize their children. If you remember, back in 2015, 14, 13, there was a huge lot of information about people who took MMR shots, measles, mumps, and rubella, that they could cause people to have autism from taking the shots. That was from a false report that came out of England just because somebody wanted to cause, and get this, you hadn't heard of it back then, fake news. And it caused many, many children not to get the shots. One of the highest, and this just amazed me because this was in the LA Times, a Sebastopol, our neighbor down the road, a charter school in Sonoma County, 11 of 45 kindergartens had medical exemptions from vaccinations last year. An additional 17 had personal belief exemptions that rolled over from the previous year. So altogether, only about a third of the class was fully vaccinated, among the lowest rates in the state. And this researcher said, to be honest, I'm a little uneasy about the amount of these medical exemptions. It just kind of sticks out. Who added that charter schools are already under extra scrutiny. He thinks the low rates are due to, now this is not me, so don't quote me here other than I'm quoting somebody else. The low rates are due in part to the politics of Sonoma County, which has a very high population of liberal thinkers, not unlike parts of this county and parts of Marin County. He invited a county health official to speak to parents about vaccinations, was recently audited by the health department, but he said there's not much he can do if parents come in with a signed medical exemption. If there's an outbreak It's going to be huge. Statewide, private and charter schools account for the majority of schools where 90% or fewer kindergartens have received all their shots. The analysis included 6,500 schools with 20 or more kindergartens, and the state did not provide data on schools with fewer than that. So a third of the schools with low vaccination rates were in LA County, followed by San Diego County and Orange County. Those are all down south. Many school administrators said they did not want to comment on decisions made by parents. Before kindergarten, children must be vaccinated for several diseases, including polio, chickenpox, measles, and whooping cough. So we had a lot of people, if you're going into 7th grade, you have to have whooping cough, that got those immunizations just the day before they went into school. Schools in particular are hotbeds for these viruses because the kids are always close together. They don't wash their hands as often as they should. They touch everything. It's very easy for infection to spread. Let's just hope a child in one of those schools that doesn't get vaccinated doesn't travel abroad and bring back one of those diseases. The increase in the medical exemptions is partially due to the parents of the children who needed one previously but had used personal belief exemptions instead because they didn't require a doctor's prescription. So it would be very unfortunate if there were physicians who shirked their professionalism and basically trying to monetize their license by putting children at risk and betraying public health. So the rarity of people who not vaccinated before SB 277 was so minute that this was just an overreaction by a lot of people. In the long haul, we have to change our culture in California. Catherine Martin, who's with the advocacy of California Immunization Coalition, which we belong to, thinks that the opposition to vaccines would fade over time. Other states, 2 states that bar personal belief exemptions, as West Virginia and Mississippi, have some of the highest vaccination rates in the country. So we're going to have to evaluate our culture somewhat in California and not allow these personal beliefs or rarity in reactions to some of these vaccines to actually propagate the vaccination policy in California. This is a law. It's a law that needs to be followed. It's not for the disadvantage of the child. It's for the advantage of the child and everybody who is in relationship going to school with these kids. It's not fair to them, but you will see in many states now we have these diseases such as polio and measles and whooping cough having epidemic proportions because kids have not gotten the shots. We never had that before. Everybody got polio shots. Everybody got measles, mumps, and rubella. You know, everybody got the flu shots, and it's one of the things that we have to be very cognizant of if we're going to speculate on whether or not you're going to be treated or you're going to get the immunizations or not. In my stores, because we're at risk for hepatitis A, hepatitis B, and flu, because we have so much contact with the public, I pay for those shots. So all the employees are covered, especially with hepatitis B and flu shots. And all of them have had their immunizations up to date as far as when they were children. We're going to take a break, and when we come back, we're going to talk a little bit about some of your information that you're not getting from the pharmacists.
Are you one of those people who wait until you get out on the lake or around the pool to put on sunscreen? Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies in Lakeport. Don't be afraid of the sun, but change your habits so you can enjoy it without putting yourself at risk. Apply sunscreen 20 to 30 minutes before you go outside, and apply it liberally. Most of us try to get by with less, a lot less, and most of us use a third to a half as much sunscreen as needed. An ounce shot glass is enough for a typical adult if applied correctly. You need to apply it every 2 hours in the water, and remember the sun rays are the most intense between 11 a.m. and 3 p.m. If you need sunscreen or you get a sunburn by not following these suggestions, come to Northlake Medical Pharmacies and we will take care of you. Northlake Medical Pharmacies with 2 locations, on Hill Road East next to Sutter Lakeside Hospital or outside the Bruno Shop Smart in Lakeport.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, August 11th. We're doing guardrail work, bridge work, pavement, and emergency jobs, all kinds of stuff. In Lake County on Route 20 near Stokes Court beginning the 16th, expect 10-minute delays weekdays. On Route 29 near Hofacker Lane, expect 5-minute delays weekdays. And on 175 near Arroyo Vista Road, expect 5-minute delays weekdays. In Mendocino County on Route 1, expect a few delays at moving locations. On Route 20, east of Chamberlain Creek, starting the 15th, expect 10-minute delays weekdays. On 101 at Ryan Creek, expect 10-minute delays weekdays. North of Long Valley Creek, expect 5-minute delays. And in the Dora Creek area, expect up to 40-minute delays. On 128, expect delays in a few locations. On 162 near Sandbank Creek, expect 5-minute delays. On 175 near the Lake County line, expect 30-minute delays. And on 253 near Singley Cattle Pass, expect 15-minute delays weekdays. That concludes the bulletin. Like us on Facebook for more updates. That's Caltrans District 1.
NCO Head Start Early Head Start Child Development Program is now enrolling for preschool and ages 0 to 5. The Head Start Child Development Program provides free services to families that qualify with children ages 0 to 5. Service for children with disabilities is provided. No cost to eligible families. Full and half-day classes are available. Families can apply any time of the year, and they also serve pregnant mothers. Call today for an application, 462-2582 or 1-800-326-3122.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month Business Design Services. Robert Bocabella, BFA, is principal and founder of Business Design Services and is a certified interior designer in private practice for over 30 years. He provides designing to fit the vision in collaboration with writing service at earthlink.net. To contact him, call 263-7073 or email him at rb@businessdesignservices.com or visit his website at businessdesignservices.com or on Facebook at Business Design Services.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, Bill, we're back.
Well, you know, I said before the break we were going to look into some of the questions that maybe information that the pharmacist didn't usually give you, and part of that has to do with getting your medications and them being so high priced. And one of the things that we have to be careful about in insurance companies are, and we don't accept this reasoning, but we're not supposed to tell you if there's a generic drug available for you and it's less than your copay, but we try to do that when we bring up a medication and it's just out of sight as far as you paying for it. We suggest that perhaps we could run it through our card program and not through the insurance company, and it would be less expensive. And many times we can't reach your doctor and insurance company to approve a refill, and people say there's nothing you can do with it. One of the things that we will do, except on controlled substances, is ask you if you have, especially on a weekend, and we don't really know if you're out of the medication or not, but if you tell us you are, pharmacists in the state of California, and in every state. I have 6 different pharmacy licenses, and they're all the same. And if it would put you in jeopardy, for example, if you're on an antidepressant medication and you've been compliant in getting that medication filled, if you're on a drug for high blood pressure and you're compliant in getting it filled, if you're on a PPI for heartburn, which we'll talk about a little bit later, and you've been compliant in getting it filled, and if you notice the thing I'm saying after all of these, if you've been compliant in getting them filled, we will give you enough to get you over the weekend. And if it's an antibiotic that has no refills on it, we can't really do that because it's usually for a specific time. If it's a benzodiazepine like Ativan or Xanax or something like that, or Ambien as a sleeping pill, we usually can't do that because it's a controlled substance. If it's a pain medication that's a controlled substance, we can't do that. So you need to be a little bit accountable for when you need those prescriptions filled. And we know now there's a huge issue in Lake County with a dwindling of physicians on getting the refills okayed on time. Everybody's trying, but sometimes we can't do that, and especially if you come in on a Friday afternoon and most physicians' offices are closed at 3 or 5 o'clock, then it's not available for us to do that. And we know there are things that require you being sharper about this, and some of them is because you have more people getting more prescriptions than ever. And some pharmacies are so volume driven that the pharmacist can't look up all day. There was a record of 3.8 billion prescriptions filled in 2007, and now we're in 2017. So you can imagine how many prescriptions are being filled today. And there are some times that we can't read the doctor's handwriting, and so we have to call the doctor. We had one yesterday, and it was a graduated dose of a medication, and we could barely read the writing. You can't interpret these prescriptions as something you're guessing at in order to fill them. If the doctors, we have specialists that are here and they want to see as many patients as they can. Many times they don't write the quantity. Many times they don't write the directions. Many times we can't read the directions. And there's a lot of e-scribing, meaning electronic prescribing. You think because it's an electronic prescription and you saw the physician send it an hour ago that it's here and being filled. We may not even have it yet. It may have gone through their server, but it hasn't gone through to the pharmacy yet. So when you're taking so many drugs as so many people are today, it is important that you're compliant with these things. And if you're compliant, we'll try to give you something to get you by. If you aren't compliant, I just had a person today, I was doing medical therapy management, and the person had 7 medications. 3 of them were compliant, 4 of them weren't. And I'm saying being out of medications for over a month for hypertension, for high cholesterol, for diabetes medication, for things that are all important to your well-being. And what we try to do in instances like this is sync your medications. It's called MedSync. So you can get them all at one time. We try to do that to the best we can, and then all of a sudden you want a 90-day supply of something, and we had them all synced for 30-day supply. So we try to inspire trust in what we're doing so we can do something that that you will believe is for the betterment of you, but sometimes that's not easy to accept. We just had a person yesterday that was upset because of a TAR, a temporary authorization request, that they needed the medication at the time, and we could not fill it without an authorization request, without the individual paying for the medication. first, and then when we got the temporary authorization request okayed, we would refund that patient's money. The patient wasn't happy because they paid cash for the prescription, and we are required by law to have a record of that transfer back to them. And I wrote them a check for the difference for what they had paid for, and in a check form. And he was extremely upset. Changed all his prescriptions to another place because he expected to get cash. That's not usually what you get from an independent pharmacy. Actually, I got this article from the Reader's Digest, and it was asking questions that you could ask about whether or not this is okay for you, whether or not there's a generic for this drug. Is there a coupon available for this medication so I don't have to pay this huge amount of money? A lot of people ask if we can fill the prescriptions for their pets also. And as long as the same drug is prescribed for humans, we can do it for your pet, and it ends up being probably less expensive than you were getting it from your veterinarian. Your generic medication may cost as much as 10 times more at some pharmacies than at others. And so just be careful. If you have insurance, always ask whether your prescription will cost less if you pay with cash. Sometimes the cash price is less than your insurance copay. The difference is what I was saying before. You have to take the initiative to ask us. And one of the things that I thought was great about this article, it says, try an independent drugstore. If you want more personalized attention and a shorter wait, try an independent drugstore. The ingredients significantly outperform chains. Independents did in customer satisfaction and wait time. And I have to tell a story about one of the patients that was at one of our competitors, a chain drugstore. And he was standing in line to get his prescription, and he heard our ad come on. And he'd been standing in line for a while, and he just walked out of line, and he came over to our pharmacy, and he said, I heard your ad on not waiting so long, and he said, I was in line to get my medication at my chain drugstore, and I heard your ad, and I wanted to know if that was really true or not. And it was true. He's been a very loyal customer since, and he thought at the time that because he was his insurance was tied into the chain pharmacy, that he would not be allowed to transfer the prescription and the cost would be more. And it wasn't true at all. Many times you think because you're retired from maybe the company that has your insurance, or your insurance company is seems to be tied to the store that you work for, that you would not be able to transfer it. They tell you that you shouldn't be able to do that, and that you need to stay with them or it will cost you more. We've had great success in transferring people that had been with their chain pharmacy for a long period of time, and was told by letters and by telephone conversations that they couldn't get it and at a competing pharmacy, and it would cost them much more, and they didn't. That didn't happen. So just to recap, when you're seeing several doctors and you have good access to health care, and there is reasons to think that you have to struggle to keep up with your prescriptions, ask your pharmacist about MedSync. Ask your doctor when you get a prescription if there's a generic available. Lots of people now are asking about addiction because of the opiate epidemic, and the president has just declared an epidemic on opiates also. You're seeing many states have 3, 5, or 7 days maximum amount of an opiate being prescribed. We had an individual today that was getting a prescription and thought that they should have had 30, and the physician wrote for 20, and it was to last for a specific amount of time, and the patient was to take a partial tablet and only on an as-needed basis, not as on a routine basis. And we went back and forth with the doctor and the nurse about whether or not the individual was shorted 10 medications, 10 of the medications or not. And we brought up the hard copy of the prescription, and the prescription was actually prescribed electronically for 20 tablets. And the individual hadn't been taking them at the new directions. You will see more and more physicians now trying to taper people off of benzodiazepines, which is alprazolam, and even Ambien, which is not a benzodiazepine, but a sleeping medication, and the brand names Xantex and Ativan. So we are in favor of doing that. It takes a long time for people to taper off some of the medications, and you would think that the pain medications would be the most difficult. They really aren't. It's the anti-anxiety medications that require a longer amount of time to take you off of. And many times your doctor hasn't told you that many times people are taking the anti-anxiety medications for muscle spasms as well, and are not going to tell you that it's going to be a problem with the benzodiazepines, but it is. The DEA, the Drug Enforcement Agency, is looking at this. They will be monitoring people who continue to be taking the medication. We will be asking you more questions on why you continue to take it. Now, it's important to know that the opiate guidelines aren't for people that are terminally ill, are not for people that have chronic pain and have had for some time, but there will be a wider description of who those people are, and they may have been even at hospice at one time, and they're no longer on hospice because their disease wasn't progressing. So all new kinds of things in healthcare that you're going to have to start looking at. One of the things that we have talked about in the past, because we think it's very much overprescribed, is heartburn or esophageal reflux disease. And you get that pain that's just behind your breastbone, and it's often worse when you're lying down or bending over. And many times that's very common. There's no reason to be alarmed about it. Most people can manage the discomfort with lifestyle changes or over-the-counter medications. But guess what? We don't want to do that. We want to take something that allows us not to change our lifestyle, not to take over-the-counter medications, but take one pill a day and take care of that heartburn. And I'm not saying that if you have heartburn, you shouldn't get an appointment with a doctor. If it occurs more than twice a week, if they persist even though you're using the over-the-counter medications, if you're having trouble swallowing or you have nausea or vomiting, you have to see what this is coming from. Normally when you swallow, there's a band of muscle around the bottom of your esophagus which relaxes to allow food and liquid to flow down into your stomach. Then that muscle tightens again. Sometimes that muscle doesn't tighten. That sphincter relaxes abnormally or weakens, and then stomach acid flows back into your esophagus and could cause heartburn and can eventually actually cause throat cancer. So it may be worse when you're bent over or lying down. There are foods, as I'm sure you know, that can trigger spicy foods, onions, citrus, tomato products, fatty or fried foods, peppermint, chocolate, alcohol, carbonated beverages. But when it occurs frequently and interferes with your routine, it's considered GERD, or gastric esophageal reflux disease, and it may require a prescription and occasionally surgery or other procedures. So you may be referred to a doctor who specializes in disorders of the digestive system. There's antacids like Mylanta and Maalox and the old Gelucel, which is aluminum hydroxide and magnesium sulfate. And that uses as a coating that will relieve that burning temporarily, but will relieve it right away. Tums and Rolaids is another one of those. And then we have what we call H2 blockers, which blocks the acid from interacting, and it's like Tagamet or cimetidine and Pepsid and Zantac. Those are all what we call H2 blockers, and they will keep the acid, even though it's being produced, from reacting so much with the rest of your gastrointestinal system or stomach. Then you have the new one, which we've talked about almost every time we have a radio show, and that's the PPIs, the proton pump inhibitors, and that actually stops the acid from being produced. There are pros and cons of that. We've specifically talked about the cons, but the pros are it is a reduction in stomach acid that's being produced. And no matter what you eat, you can usually get by taking a protein pump inhibitor. We're talking about omeprazole. We're talking about Nexium. We're talking about the pills that actually you take 1 or 2 a day of, and it keeps it to the point where you're not uncomfortable anymore. So what are you going to do if you can get something for $5 or $10 for a 30-day supply and not change you can still eat the pizza, you can still have the onions, you can still have the fried foods, you can still drink the alcohol or carbonated beverages, you can still have the larger fatty meals. Well, most of us will do what we do, and that is keep getting the prescription refilled. Some of the things you have to ask your doctor are, what's the most likely to cause my symptoms, and is it just a temporary thing? Do I need to take more tests? I had a person the other day that had all kinds of stomach problems, and it ended up she had an ulcer. And 95% of the ulcers now can be treated with antibiotics. We used to treat them with the H2 blockers. Is there certain foods that you shouldn't eat anymore? And how do you handle the rest of your conditions that also relate to this? So lifestyle changes are the best thing to control your symptoms until you see the doctor. You know the foods that are triggering that, and you're the one that can stop those kind of things. Many over-the-counter items can help you, like we were talking about the H2 receptors, or beta blocker, or blockers, H2 blockers, the antacids, the proton pump inhibitors. You know what the things to do if you get that heartburn at night, and one of them is to lay down and have your head propped up so that acid is not going back into your throat. Avoid tight-fitting clothing. You know, I'm flying tomorrow, and I'll be on the airplane, and there'll be people in there that are squoze into their clothes, and they'll be overweight, and they'll be eating Tums like crazy, and avoid that tight-fitting clothing. It puts pressure on your abdomen and the lower part of that sphincter muscle. So and late meals and smoking, alcohol, all those things are going to cause an issue. So it's called preventative health, and we don't like to do that these days. We like to think that we have enough medication that we would rather take the medication than make a lifestyle change. But we get to the age where how many things can you do now without trying to be healthier? As your joints get harder and to work, and you get stiffer, and you take more medication, and all of a sudden you're getting muscle soreness from some of the medication like statins. You're just not feeling good as you continue to age, and there's all kinds of things that you can do to make it better without costing you any money. And one of those things is a lifestyle change. Does it take a lot of effort? Yes. And you see these things on Facebook all the time, like, you know, I'm 70 years old, I deserve it now, and it's my turn to dance in the streets, to booze until I can't stand it, to eat all the spicy foods, to not worry about my diet, and all of those come with a price. I'm not saying that I'm an angel with any of those things, but I do know the value of a lifestyle change. I do know the value of exercise. I do know the value of being informed about my health. And my goal is to inform all of you about your health and make sure that you have the option to change those things. They aren't drastic changes. I mean, exercise, for example, do 15 minutes a day, preferably a half hour, but you don't have to do anything extreme. If you have a swimming pool, go out in the swimming pool and do your things during the summertime so that doesn't put any stress on you, even a hot tub. But be careful about taking your medication and being compliant about taking it, because when you get in trouble and you need that prescription to get over the weekend and you haven't been compliant, then there becomes an issue. And sometimes we have caregivers that take care of us and order our prescriptions for us. And if they're not doing their job, it puts a big bit of pain on you as far as being compliant. You have access to good health care. If you're taking more than 5 different drugs, you're at a risk for any kind of a reaction, and there are warning signs that you may be on too many meds. So we've told you before, that's polypharmacy. We've also, we're going to remind you in October, there's a brown bag day. I can't remember if it's the 21st. Anyway, it's a day that pharmacists want to look at all the medications that you're taking, including those things that are on the back of your prescription shelf that expired 2 years ago, and why you still have them sitting there. We talked the other day about expiration dates on over-the-counter medications. What do they mean? Expiration dates on antibiotics. When I was in the military, we used to get a Twix every year when many antibiotics were expiring, and they would tell us to change the expiration date to a year beyond that expiration date, and it was good. We had to post those signs in the pharmacy, make sure we knew that they were expiring, and they had gotten a year's reprieve. So as we talked about last week or the week before, their expiration dates mean sitting on the shelf without exposure to high heats or cold temperatures, never being opened, and if that is certainly in effect, those expiration dates can be expanded. If you open your medication bottle and you see a difference in color, a smell that's unusual, that it didn't smell like before, a deterioration of the powder that's in a tablet, those medications are probably no good. Are they going to make you sick? Probably not, but they aren't going to be as effective. So you need to make sure that if you kept them around for 2 or 3 years, they're probably not going to be effective for anything but an emergency when you can't get a hold of the physician. You still have to be responsible for what you do and how you do it, whether it's a dull, achy, sharp back pain that makes it hard to concentrate on your job, or if it's a heartburn that's just not going away. I just spoke to a friend of mine today from the East Coast, and he is my age, 75 years old, and his son is 46 years old, and he's getting his second brain tumor from cancer. And of course, a parent never likes to see one of their children go before they do, and it is, and he's been very attentive about his health. But how do you handle that at 75 years old, and how do you tell your son at 46 years old everything's going to be okay? And that's just part of what we're dealing with as we learn to live longer. And my father died at 65 years old. I'm now 10 years older than that. My mother died at 94. I don't think I'm going to make it 10 years older than she did. But I'd like to remind you, thank you for listening, and remind you that we're Northlake Medical Pharmacies at 2 locations for you, at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday for Health Talk, right here on AM 1270 and 96.5 FM, KXVX Lakeport.